Okay.
So here we are. So I'm sure most people heard something about the disaster in Wisconsin, where they, despite kind of recommendations from the public health officials, they proceeded with the in-person primary elections despite being in the middle of the COVID pandemic. And so the state legislature refused to postpone, and voters were thus forced to decide between voting or, getting potentially sick, very sick. And a study actually came out documenting what you would expect was that the rates of infection after the election went up in accordance with who was associated with having voted or having worked at the polls. And, Wisconsin represents the state of many of our election kind of situations in different states. And, I think we're all petrified of the possibility of voter suppression, like probably what happened in Wisconsin, either voter suppression or a surge because of people exercising their right to vote. Either way, it's a bad situation. And so that's what led to this conversation today. We're really excited to learn from an expert. Michael Lattner is going to kick us off, and he is a Kendall Voting Rights Fellow at the Center for Science and Democracy at the Union of Concerned Scientists, one of our really amazing allies in kind of all of our work, really advocacy. He's on sabbatical right now, which makes me jealous, from California Polytechnical State University, where he's an associate professor of political science and public policy. And he's published extensively on election-related issues in academic and popular press, and has co-authored many articles in things like The Guardian and The Washington Post. So we're really, really glad that you are sharing your time with us and are excited to learn from you. So I'll kick it off to PhD, Dr. Lattner.
Great, thanks Ashley. Thanks everyone for having me. I'm really excited to be able to share a little bit of time with you, summarize what's going on across the states, what's not going on, and talk about effective interventions to ensure that we have a safe and secure election for all voters, regardless of where they live. So I'm going to highlight some of the findings from a recent analysis that the Union of Concerned Scientists conducted in collaboration with the Voting Rights Lab and UCLA's Voting Rights Project. And so if I could go through the next slide, we'll talk a little bit about what we know. That is, what's the political science on election day experiences, and how does that intersect with the health data and the public health evidence that we have regarding risk of COVID-19 infection. So what we know is that there is a high level of correlation between the risk for COVID infection and voter congestion, specifically long wait lines. Next slide. So the single most important thing that the research has been clear about is that we want to reduce the time of exposure, right, and the magnitude of exposure. Typically, where we're going to find that is not so much in the actual polling place on election day for people that show up to vote in person, but it's the time spent in line. Because even in California, where you need an additional graduate degree just to get through the voter pamphlet, given all the issues that we vote on. The time actually spent checking in and processing your ballot, either through an optical scanner or whatever type of voting system your county uses, and then submitting that ballot is typically shorter than the average wait time. So where wait time occurs, and if you think about this in terms of queuing theory, right? The longest lines are in the mornings on election day and after work, and that's where you get this bottlenecking. And so that's where the greatest risk of COVID infection emerges on election day, and that's what we want to minimize. So our goal is to flatten out the curve of election day congestion. So first to minimize that, and then we want to think about safety procedures and requirements on election day. Next slide. So one of the primary concerns, as I mentioned, that we have is that the distribution of risk is not distributed equitably, as in many things in life. What the research on voting day wait time shows is that there are large racial disparities in wait times. And this is true for a variety of elections where studies have been done: primary, special elections, early voting, election day voting, and using a number of methods. So using, taking samples within precincts, looking at social mobility data, using cell phone data. There are a number of varieties that all point to the same conclusion, and that's that there are a set of voters where the wait time is concentrated. And those are voters that live in dense urban areas that are densely populated, voters of color, voters with disabilities encounter more problems and have longer average wait times. And so in many cases, the populations that are most at risk for COVID infection are the same populations that have the highest risk of being exposed for longer periods of time on election day. And so that's sort of the intersection of the health and political science in terms of identifying where the risk is and what's the nature of the risk. Next slide. So looking at how to reduce those wait times, how to reduce voter congestion, there are 4 items that the research has identified. Number one being the number of options that voters have. So here in California, Governor Newsom and the state assembly have moved California to what's known as a universal vote by mail system. So every eligible voter in the state will be receiving a ballot in the mail. That's the most efficient and cost-effective way to ensure that every voter has the option of voting safely from home. And that's really the gold standard that every state should be pointing at. And we'll look at some of the changes that states have made in just a moment. So you want voters to have options, namely vote by mail, also early voting. We recommend 2 weeks of early voting to spread that out across time to give voters the maximum convenience. California has decided on a 4-day model that would allow some weekend voting and then early voting on the Monday prior to election day. Which is, it should be fairly effective. We know that early voting happens more often on the weekends, and especially, again, given our focus on equity, the percentage of voters that vote on Sunday is larger among those same communities that risk longer wait times. And so it's a good trade-off. It's not ideal, but again, the ideal conditions are very quickly hitting the wall of reality in not just in California, which is doing things well compared to many other states, but the practical reality is that state and local election officials are dealing with an emergency situation where the number of poll workers available has been reduced drastically given the average age of poll workers and some of the things that Cynthia will discuss as well. So there are these practical realities and trade-offs that have to be made. So I'm going to sort of lay out ideally what we'd want to do, and then we'll talk about the realities. So early voting, having a number of days open, and making sure that there are hours and locations that are amenable to those who need it most. So having after hours voting locations open and ensuring that those locations are not, that the vote centers are located not just where there's the highest number of high propensity voters, because in this situation, most of those folks are going to be voting by mail. And so it's really important that local election officials focus on where the need is greatest. That is, looking where their previous elections have had low rates of vote by mail, because that's where those voters are going to be concentrated. Third, points of service. And again, this gets down to the sort of practical trade-offs that election officials face. But the more voting machines that we can have within a polling place, a consolidated precinct or a vote center, the faster we can process voters. And that gets us to our fourth point, which is related to this, which is reducing the transaction time. And so here the trade-off is pretty clear, right? The CDC guidelines are to maintain social distancing standards of 6 feet within polling places, and we would certainly want to maintain those outside of polling places. But as health experts, I think you can recognize this, that there really is a fundamental trade-off here in practicing those social distancing requirements within polling places, because what that means is that we are reducing the capacity of polling places to about 25 to 35% of their normal capacity by having that many fewer machines, because they have to be spread further apart and we have fewer people in the polling place at one time. And this is really an area of concern, frankly, for many public health officials and election officials, because even though that time to vote, as I said earlier, is shorter, being able to reduce that transaction time can greatly reduce the amount of time that people spend in line. And so there really is a fundamental trade-off. And some public health officials are rethinking whether or not those social distancing guidelines should apply within the polling place, given the level of exposure that might create, especially during early mornings and around evenings when people get off work, because that's when the lines really expand. And so there is a trade-off there that I think is worth considering. And you know, it doesn't need to be said that attending a polling place is not like going to a church or other public event. And if anything, it's more like going to a public urinal. And it's been said before. I didn't just make that up. But it's not the sort of social experience that you would have in a broader setting. Okay, next slide. So let's take just a quick review of how things have changed. This map from Daily Costs was created in March, and since March, you can see that there have been some changes. So really before the onslaught of the pandemic, there were really only 5 states that we would consider having achieved kind of the gold standard of where we should be in terms of our capacity during a pandemic. And those states are Washington, Oregon, Utah, Colorado, and Hawaii, which had already made this switch to a universal vote by mail system that is providing every eligible voter a ballot in the mail. Colorado in particular really has developed over several years what I would consider the ideal model. That is, they have universal vote by mail, so everyone gets a ballot in the mail. They also have a set of consolidated vote centers. And those vote centers are one-stop shopping where it doesn't matter where you live. You can drop off your ballot at any center. You can fix your registration. You can do any of the services that the county clerks or registrars typically provide in California. And you can do that on election day in Colorado. And that's really the model that we should all be aspiring to. Obviously, states are not all there. Indeed, many states, you can see on this map, the states in gray, require an excuse. That is a health excuse or some reason that makes it impossible to go to a voting station to vote. Again, along with the universal vote by mail, there have been some changes. So California is one state. Vermont is another state that has moved to the universal vote by mail model. So all California voters are going to be receiving a ballot in the mail for this November, the same in Vermont. A number of states have done what the sort of second best maneuver, which is to provide all voters with a mail-in application. This is 1, costly, 2, less efficient, but it's better than nothing, although it certainly doesn't get us anywhere near the gold standard of applying mail voters. On the other end of the spectrum, many states that used to require an excuse to vote by mail, they've lifted those restrictions. And so actually, I believe just yesterday in Rhode Island, a federal judge lifted the suspension for voters there through litigation. A number of other litigation efforts have also provided relief in states, Ohio and let's see, I think Montana and Minnesota. There have been a number of states that have lifted those restrictions for the November election so that anyone can vote by mail without an excuse. That said, there still are a number of states, Texas in particular, Louisiana, Mississippi, that not only did nothing during their primaries in terms of expanding vote by mail, but have been actively fighting against it. The Attorney General of Texas in particular has threatened to actually sue county officials if they expand vote by mail options. And we've seen a lot of other more nefarious activities taking place in some other states. So the bottom line is that there's a great variety and range of options that are available to voters depending on where they live. And so unfortunately, it really should not matter where a voter lives. Everyone should have equal access to the ballot, especially in a time of pandemic as we're experiencing this November. But that's not the case. So what is needed is federal action. We need the federal government to provide federal standards and to provide funding, specifically the type of funding for investment in infrastructure. So even the states that are trying to do the right thing, and states like Kentucky that tried to move swiftly to vote by mail during their primary, what we saw there is that there wasn't the level of training and preparation that was needed to really pull this off. And so, while a state like California, we had years of experience with vote by mail. Some states in Kentucky, or some counties in Kentucky, I should say, had ballot rejection rates as high as 8%. Nearly 1 in 10 voters, their ballots were rejected. And that was through, mistakes like not having the flap properly removed on envelopes, or voters forgetting to sign their ballots on the back. And that's something that we need to be concerned about here in California as well. Whenever you have a large influx of first-time voters using a new methodology, there are going to be errors. And so we need to prepare for that human error. Next slide. And so this is just a summary of what changes have taken place, where states are in terms of their preparedness. And as you can see, a number of states, as I said, have moved to vote by mail, at least making it available, an option for voters. But there's still a lot of voters, about 25% of the population of the US as of today, still does not have the option of voting by mail without an excuse. And so we can expect a lot of inequity on election day, and even with states that have changed their election laws, without the investment in infrastructure, without the investment in public outreach, and without, frankly, the participation of professionals like yourselves, we really are steering ourselves into an electoral disaster. So I'll leave it at that unhappy note. But there's a lot of work to be done.
Thank you so much, Michael. We're really eager to hear more about exactly how to put our voices to work. And next, we're going to hear from Climate Health Now's own Dr. Cynthia Mahoney, one of our co-founders, who is a retired nephrologist here in the East Bay Area. And she's going to share with us about healthy voting procedures for in-person voting, which does need to be part of the election process. It can't just be vote by mail, and she's going to tell us why and how it can best be done.
All right, thank you, Ashley. And Michael, thank you so much for that excellent overview of the political landscape and what we're up against. So I wanted to start with the principles and best practices, if I could have that slide, thank you. And just to frame again, why do we care? Why are we doing this for a group of health professionals who are formed around climate action? It's because we can't have a democracy, which is to express the will of the voters, without fair, safe, secure elections that voters trust. That's also very important. And that expressing the will of the voters, we know that most voters want action on climate change. And it's not happening partly through voter suppression and other issues in our voting system. So we really need to get this right. And it's even worse now because of the pandemic. So the goals And then Michael has talked about this from a political perspective. I'm going to flip things around a little bit and talk about it from the perspective of physicians. And we're used to thinking about how do we make things sanitary, and do we need PPE, and how do we put them on and take them off? So sanitary procedures throughout all phases of voting. But you'll notice on the slide, I put that first because that's what we think about, but it's labeled number 2. Because the more important thing is how we design the election, just as Michael has said, to avoid unnecessary contact, both by encouraging vote by mail and shortening exposure time and spreading out the space. And the analogy to me is like looking at automobile safety. We don't just look at how do we design the brakes, we look at how do we design the road. Is it straight? Is it well lit? Is there enough time on the on-ramp and off-ramp to merge safely? Do we have traffic lights? So that design is really integral to the safety. And that's looking at things more from a public health aspect than the sort of individual patient care that many of us are used to. So there are 4 key strategies. Make registering from home easy, make vote by mail easy, ensure safe, accessible in-person voting, and guarantee an accurate, secure election count. So I'm going to go through a compendium of principles and best practices just very briefly, and we will provide this document for you after the talk. So as Michael mentioned, universal vote by mail is the thing that we should be striving for, the best option during a pandemic. But in-person voting is still needed by people with disabilities, by people with language barriers, by people who just prefer in-person voting because they don't trust these other options. And that tends to be mostly people of color. And as Michael also said, it requires funding. Next slide. So I'm not going to go through all of these in detail, but vote by mail, we need universal vote by mail, no excuse, and get the ballots to everyone, not require that you request the ballot. That doubles the number of interactions for the Postal Service and the number of chances for mistakes. We need to minimize hindrances like requiring exact signature match, this is incredible, in some states during the pandemic, while people are sheltered, they require photo ID, notary signatures, or 2 witness signatures on your ballot. How do you do that when you're sheltering in place, right? And the key point here is that election officials, which is county and states, can change their procedures. And we have a role to advocate for the need to change those procedures. Then we need to assure that the votes are counted with rigorous processes. So we've talked a little bit about mail and funding the USPS, allowing adequate time to send and return, making sure that they allow votes that are postmarked not by the election, not just returned. Imagine with the mail service like it is with 17,000 postal workers out with COVID, the mail's going to be late. It's so through no voter fault, you may not get your ballot in on time. Provide secure drop boxes, provide ballot tracking, and allow time for voters to cure mistakes like the signature doesn't look right. Training, allow the election offices to start counting when the ballots arrive. Now, some states say you can't start counting till election day. Well, that causes a huge backlog. Next, please. The good news and why we're focusing on vote by mail is that the sanitary procedures are super simple. Quarantine the ballots for 3 hours. That's how long the virus lives on paper, and prefer self-adhesive envelopes. Nobody knows how long the virus lasts in a licked envelope, but let's try and avoid that. And then poll workers practice frequent hand hygiene when they're handling the ballots and clean and disinfect voting machines. Next. So we've said that we're still going to need in-person voting, both for the people that desire it and disabilities, but also even where we have that, it's been a disaster during the primaries, mostly in states that are just rolling this out for the first time and don't have experience. So in the primaries in 2020, many states failed to get absentee ballots to thousands of voters. These are just a couple of examples. In Wisconsin, 14,000 people didn't get their absentee ballot, and then they had to go stand in line. This is actually Georgia. And if you look at this line, you see only a few people had masks, and this certainly isn't 6 feet. In Maryland, fully 5% of people did not get their ballot. And in Georgia, many. Next. Even when people get their ballot, there's that problem of ballot rejection, or it's also called spoiled ballots. So in the 2020 primaries, New York City had a disaster, a train wreck, where 19% of the ballots in Manhattan and Queens were rejected. And in Brooklyn, which is largely people of color, 28%, because those people are much less used to voting by mail. Even in California, in our recent primary, 100,000 voters were disenfranchised, mostly because of missing signatures or missing or late postmarks. Next. So we will need in-person voting, and we need to design the system for safety from the front. So facilitating social distancing with adequate number of polling places in the right spots, as Michael said. I'm not going to go through more of this. Designing the polling places so we have large buildings with optimal ventilation, one-way flow, marked 6 feet entrances, avoiding long lines. I want to make a special call out for hand-marked paper ballots. Some places, because voting machines and limited numbers of voting machines and voting machines who can't be plugged in are all ways of suppressing the vote and creating longer lines. To have a rule where you have to have standby hand-marked paper ballots that are available if the line's more than 30 minutes or more than 10 people, that can go a long way to improving things. And we can encourage voters to bring their filled out sample ballot with them so that when they try to mark the machine, it goes much quicker. And we want to recruit poll workers from low-risk groups and do daily health screens. Next.
Cynthia, just a 2-minute warning if possible.
Okay, so then we have sanitary procedures for in-person voting, discouraging people to enter if they're sick. Masks, there's a lot of different guidance. They should be mandatory according to the UCS. We should provide disposable masks according to the Secretary of State, where the CDC just recommends cloth masks for workers and only encourages it for voters. And voters will refuse masks. I was at first appalled when I heard this, but we can't prevent people without masks from entering. The goal then is to decrease confrontation so that people aren't yelling and taking even longer, and just try to provide a separate line and booth. Next. There are a number of other procedures that help with sanitation. I think these will be obvious to most of us and will be in that document. So I'm going to skip past. Next, please. So what about COVID positive contacts? We need to anticipate that in a pandemic, this could affect anyone at any time. So we know the best prevention is universal vote by mail. There are questions about what to do. We still don't have this worked out. It would be great to have curbside voting. That's not always available. And they're recommending full PPE for poll workers, but is that really feasible? Are they going to be trained to put them on, take them off, and even have them when health workers don't? So there's a lot of work to do in that area. Next. Lastly, we need accurate and secure vote count, because trust in voting is essential for turnout. People won't vote if they don't trust the election. And that means niet, no in Russian, for those of you who don't speak it, to the internet, any internet connections for voting, for poll books, for machines, paper backups, and a secure chain of custody and audits. Next. So what is the health professional's role? We can advocate for vote by mail at the state level. That's important. Counties control the actual procedures, so we can advocate at the county level, and we can educate voters. So here's an example of social media from UCS that we can tweet out or send, and we can advocate for absentee ballots. We can advocate for good design of systems and educate voters with simple messages like, remember to sign, seal, and deliver on time. And those toolkits are available, and we'll have links for those. Next. I want to turn it over to Bev Harper to talk more about the Medical Society Consortium and what they're doing. Ashley, are you going to do an intro?
Yeah, I will. Thank you so much, Cynthia, for giving us that background. So a couple reminders. If you have questions, our ally, Sarah, is going to be kind of looking through all the questions, and we will get to those at the end in about 5 minutes or so. And yes, I'm really excited to introduce Beverly Harp, who is the Digital Communications and State Policy Manager with one of our ally societies, the Medical Societies Consortium on Climate and Health. And she's going to share with us about what they're doing, and you know, we're actively looking at ways to collaborate more. So over to you, Beverly. Thank you for joining.
Yeah, thank you so much. I'm really excited to be here, and it was great to learn from Michael and Cynthia. So the consortium is a coalition of 29 medical societies and at this point 50 health organizations. And so we came together to send a letter to Congress last week signed by 54 health organizations, including the NMA and the National Hispanic Medical Association, PSR, Climate Health Now, and really quite a few groups basically asking for what Michael and Cynthia have referred to as the gold standard for universal vote by mail. So we sent that letter to Congress, and we did get some media coverage and some social media blast response. But really, like we said, we know that the opportunity for action is at the state and local level. There would have to be a miracle to see national action on this issue before the November election. So what we are asking now is for our state groups and for all of our partner state groups to start organizing on this issue and to really get the word out that as health professionals, if we care about health equity or climate justice or racial justice, this is our issue, and it's an issue that our voices can be really powerful on. And even if you just care about public health, this is our issue, and it's an issue our voices can be really powerful on. And so we have a website, and I know we're going to go through some of the actions we have listed, but we have everything you need to take action at the state or local level. And you can see where your state stands, find out who to contact, see our social media kit that's made for healthcare professionals. And we're also promoting what someone shared, that New York Times article, an effort that is being made to provide any healthcare provider or institution that wants one with free badge backers that have a QR code, so you can help patients or anyone you encounter, scan the code and register to vote. So there's really a lot that can be done, and a lot of people who are ready to listen to the voices of healthcare professionals. So we're really excited to work with partners on this call to figure out how to get our state groups to take action and organize on this in the next few months, really in the next 2 months, and we're happy to be here.
All righty, can you guys hear me?
Yes.
Oh, fabulous. Okay, I feel like I'm flying blind here because I can't see you guys because I have PowerPoint open. Alrighty, so we are going to take things now into the action part of our action hour. And thank you again, Michael and Bev and Cynthia. And we are going to circle back with questions after we take our actions. Ashley, can I ask you to set a timer for each of our actions just so we can stay on track?
Yes.
Perfect.
Yeah.
Okay. Excellent. Alrighty. So the first action, and the idea of this is that these are things that we are all going to do at the same time on this call so that we can check them off of our to-do list. The first action that we would like everyone to take is to sign the open letter that has been written and is being maintained by the Union of Concerned Scientists that is about healthy voting, that seeks to basically keep voters as safe as possible while exercising their right to vote, and advocates for science-based solutions. And this letter is open to being signed by anyone who is a health professional, a public health expert, or a voting expert. So everyone on this call should qualify as an expert in that regard. So if you are able to click on this link at the bottom of the slide, it should take you to that letter, and we're going to give you, let's say, 3 minutes right now to sign that.
It's also in the chat if
Perfect.
that's easier to place the link.
And for bonus points, if you are a quick signer, you could send that link to somebody else you know who could also sign.
Yeah, it also has a link to tweet it out or put it on Facebook. So that'd be another great way to share the love. Okay, we'll take about 1 more minute. Perfect. Yeah.
All righty. So thank you guys. That was action number 1. We're going to go into action number 2. And this brings us back to what Bev was just talking about and the work that the Medical Society Consortium is doing. So here we are breaking this action into two different actions for people who are in California and then for people who are outside of California. So for both groups, we want you guys to go to the Fair and Healthy Elections website, which is the first hyperlink that you'll see there in blue. And that's where you can click on the link to view the letter to Congress that was signed by more than 50 health organizations and was delivered on July 21st. That is calling for universal vote by mail and healthy elections. For Californians, what we are asking of you, because we already have universal vote by mail, is we want, if you have social media, it could be you tweet or have social media for an organization or for just you as an individual, we want you to share out this letter. And the way that you can do that, the Medical Society Consortium has a toolkit that's on the Fair and Healthy Elections website. It's under step 4. If you click on that toolkit, it'll open a Word document that has sample tweets and sample Facebook posts, and I believe sample LinkedIn posts as well. So for our Californians, that's the action that we want you to take right now, because we want this letter to get as much viewership and as much attention as possible. Mm-hmm. For non-Californians, we want you to follow step 3 on the Fair and Healthy Elections website. Which is basically sending a letter to your state representative. There's a hyperlink there so that you can look up who your state representative is and how to contact them. We want you to use the form email that's also on their website to ask your state representative to ensure that every person who is eligible to do so in your state is able to do so by implementing a vote by mail option before the November election. All righty, so let's give ourselves, this is a little bit more complicated, let's give ourselves 4 minutes for this.
And if you have any questions, go ahead and ask while others are doing the action. And I put them in the chat if that helps. we'll take about 1 more minute.
I just wanted to plug the graphics on the social media toolkit for Californians. They're really pretty. So if you're posting on Twitter or Facebook, try to download and link one of those graphics.
Yeah, thank you. That's a good point. Those are at the bottom of the toolkit. Yeah, they are pretty. We should use those. Great. So we'll wrap up this piece. And also, by the end of the day today, we'll send a summary email that has these action steps kind of bulleted so that if you don't get to finish something, you can come back to it. But hopefully that was enough time. And then we'll move to action number 3.
All righty. So action number 3, which we heard about from Bev as well, is to request a lanyard from an organization called Vote. I don't know if they call themselves Voter or Vote ER, but they're an organization that is specifically working to have medical providers get out the vote. And so what we are asking everyone to do is to register to get one of their lanyards that comes with the QR code to help your patients register to vote. We know that not everyone on this call sees patients or is currently seeing patients. So if you are not someone who currently interacts with patients, we are asking that you send this link to someone or multiple people who you know who do see patients so that they can register for this. And very, very excitingly, this organization was just highlighted 2 days ago in a New York Times article. You can see the title for that there. And we have a full PDF of that as well for people who can't get to it behind the paywall.
And I'll try to attach that. Yeah,
Great.
so we'll take a couple of minutes to register for your QR code that you can use to register patients and anybody on the street.
Right.
So yeah, take a couple minutes for that. Great. And then next, it would be perfect to, if Sarah, you could share a couple of the questions and then we could ask Dr. Lattner and Beverly and Cynthia if you can weigh in as appropriate to the questions that we've accumulated.
Yeah, absolutely. Thanks everyone for your wonderful questions. If you have more, feel free to drop them in the chat. But I just to start by asking Michael and Bev and Cynthia, if you have heard of any conversations about mobilizing health professionals to provide medical excuses to all voters in states with restrictive mail-in voting options so that they are able to request ballots.
If I could add to that before too, because that the notion was brought up by the Healthcare Without Harm. They did something similar for the climate strikes, that they wrote this kind of generic medical excuse letter for students who are striking. So that was kind of where the idea came from.
Yeah, I wrote some of those excuses for striking students and for students that were missing school to go talk to CalSTRS, for example. So I think that's a fabulous idea, and maybe we should come up for a template for that. We'd love people to join us in our healthy voting team that's going to explore some of these ideas and get more of these actions out over the next month. Michael, have you heard of anybody doing that?
And no, I have not. In the states where it's allowable, I think it's a really important innovation. So there are a number of states that have essentially expanded they haven't changed the law to allow no excuse vote by mail, but they have changed the allowance for what is allowed as an excuse. And so Arkansas, Alabama, a few other states, the governor or secretary of state has explicitly expanded concern of COVID infection as a valid excuse. And so you'll need to check which state you live in, if that's a valid requirement or not. A number of states, unfortunately, have also explicitly prohibited fear or concern of COVID-19 infection as a valid excuse. Texas, Louisiana, Mississippi, a number of other states. So it's important to check what your state law is, but then a general template for that I think would be a great idea.
Thank you. We had some other questions about how to ensure safety of in-person voting sites. There were questions about having voting sites set up outdoors to reduce risk, and also whether people who waited in lines outdoors also showed a higher rate of infection, or if this was only for people who were waiting in lines that were indoors.
Wow. So I know some states are setting up curbside voting. I don't know enough about that. Some of that may be up to the specific counties. I know Kamala Harris has a bill that she's introduced to do curbside voting. And I'm hoping Michael can tell us more about that.
Yeah, a number of states have already provided curbside voting, which is essentially a sort of drive-through voting. There are a couple of ways to set it up. So Oregon has been doing this for quite some time. This is the model where you either have literally like a drive-through window that provides protection for voters in vehicles, or much like we've now seen grocery stores and Home Depot and places like that adopt basically a curbside delivery method where you're using a parking lot or other area for persons with or without vehicles to be able to call in or text in their request for a ballot. It gets brought out. There's an exchange, or you could drop off a filled out ballot at a specified polling location. So that's certainly an option that many in counties in California are also pursuing that as well. So SB 423, which is actually going to be on a floor vote this Thursday, tomorrow, in the California Assembly, encourages counties to provide curbside voting where it's possible. I would also add that there are a number of states that have taken, and a number of municipalities, frankly, taking the lead on trying to expand voting centers to very large locations. So sports arenas and other really large locations where you can practice social distancing and you've got good ventilation and the like. And that should be encouraged as well. But all of this requires a lot of public outreach and a lot of public education, because once you start changing polling locations, low information voters that don't have access to that information, the research is pretty clear that it shows that you're going to reduce turnout, and that reduction of turnout is not distributed equitably across the population. I don't also address the question on polling place versus waiting in line. The studies that have been done basically just look at the number of ballots that are, so the Wisconsin study in particular that showed the spike in the positive testing rate for COVID, looked at the average number of voters submitting ballots per precinct at the county level. And so we're not able to tease out infection rates within versus standing in line, but we do know, and the epidemiological concern is that the goal is to reduce overall exposure. And what we do know is that the time inside the voting place is typically pretty short, shorter than the 15 minutes that CDC even uses to start measuring exposure time. So our real concern is that we're going to see these long lines, as we've seen in some other states during the primaries, where you've got people waiting in line a half an hour, or several hours. That's really what we want to avoid.
Right, and in Georgia, they've had lines like 9 hours. I called a voter in Georgia a couple years ago who said, "Have you gone out to vote?" And she said, "Well, yes, honey, I'm 92 years old and I went out to vote this morning, and after 5 hours, I got tired and I came home."
That's right, and that's what, we know that we're going to see that, and so and that's frankly that's malpractice, whether we're in a pandemic or not. No democracy should be experiencing those kinds of problems.
So if we could take just about one more minute for questions, and then we'll turn it over to a summary.
We've had a couple questions about what we can do at a county level to help improve the accessibility of voting in our counties.
Michael, why don't you take that first, and then I'll.
Yeah, sure. I think, Cynthia, you can probably follow up with specific details, but my understanding is that so as a voting rights expert and as a political scientist, my expertise only goes so far in terms of pointing out sort of the engineering of how to provide a safe election. I think that the health messaging here is crucial, because health experts and health professionals have a different level of authority that they speak to outside of the voting rights circle. And so I think communication with your county registrar, your county clerk, open and frequent communication with your county behavioral officers is absolutely crucial for November, because voters trust health officials. Voters trust health professionals. I'm just sort of an election science geek that people, I deal with very abstract things. People understand the direct relationship between their health and the kind of behavior that's being required of them. So I honestly, the perspective of health professionals is, I think, the most important perspective come this November.
Thank you. And I think that kind of brings us to something we want to flag, is that like Amanda or Cynthia mentioned at the beginning, so we're starting kind of a team to talk about healthy voting and continue organizing around this extremely important issue on an ongoing basis. So we have a new channel in Slack that's called the Healthy Voting Team. And Lisa, I just invited, oh, you're not comfortable with Slack. Okay, well, we can work on that. But we for those of you who are, it'd be really helpful to join there. But that's something that we want to keep talking about in this specific way of, in our counties, in our state, what really concrete actions can we take? And so that's something that we'll be continuing to work on. And then I'm going to turn it over to Amanda for our summary and closing us out.
Excellent. All righty, guys. So thank you, and thank you again for excellent questions and excellent input. We see, clearly there are a lot of unanswered questions here, and this is a really huge issue. I think that's probably an understatement. For those of you guys who were on our call last month with Tom Steyer, he shared that not only is this the most important election of our lifetimes, it is probably the most important election in the history of humanity. So this is no small task. And there is much to be figured out. I think this question specifically of how to guide voters who are COVID positive or aren't feeling well, who are intending to vote in person, who can't, how to enable them to vote healthily and safely is a really specific but important question that a lot of work still needs to go into. So the messages, that we want to leave you guys with, and what we're hoping to build on from here. Number one is that our voices as health professionals and health students are incredibly valuable. We just heard Michael say that. I would argue in any election that's the case, but no more than right now. And we are obligated to use our voices. And so we hope we can be a conduit to that. I think most of us already know this, but voting is a climate issue. And that's really what it comes down to. We have to get people to vote, and we have to elect into office people who will take the actions that we know are necessary. We don't need people, we can't have people choosing between voting and their health. We need universal vote by mail, and we need a mechanism to fund it. The HEROES Act, which is potentially being voted on soon, would do that, although it's unlikely, or it's unclear whether that will pass. That would be one mechanism. But not the only one. As we've heard today, voting by mail is not a panacea. I think a lot of people jump to, well, if we just have universal vote by mail, that will solve all of our problems. But as we learned today, and as we're still seeing, that isn't the case. There are so many issues with people not getting their ballots, people not wanting to vote by mail, et cetera, et cetera. So we still need a way for people to vote in person. And many of these details are going to be decided at the level of our individual counties with our county clerks and registrars, who really will set up the actual logistics for how this will all go. So here are some next steps that we are proposing. So you heard today about our Healthy Voting channel in Slack. We would love to get a community there that is taking action on some of these things. So we have some ideas for op-eds and organizing, but we are certainly open to any way, any place that people want to take this. And if you're not on our Slack or need help with that, let us know. The Union of Concerned Scientists and the Medical Societies Consortium are both much larger than we are. If you're not already getting updates from them, please do so. At a more local level, find out what is going on in your county. One thing that we are thinking of moving forward with is a call or a webinar between health professionals and county clerks or county registers, where we could share some of these ideas and allow for question asking. So I think I'm willing to bet most of us don't know who our county clerk is and don't have a relationship with them. So this is a time to reach out, introduce yourself, find out who that person is, find out what's going on in your county. And as per usual, we will be sending out a follow-up email that includes all of these actions. We have some bonus actions that relate to these that we didn't have time for today. And thank you guys all for your time. Thanks for being here. And we have an incredible task before us, but I hope we can do it. And thank you guys.
Yep. Only together will it be
right.
successful.
Certainly only together. Yep.
Thank you so much, especially to Michael and Beverly for joining. And we will be in touch. Okay. Have a great day, everybody.
Thank you. Bye-bye.
Thanks for joining us.
Cynthia and Amanda and all of you wonderful leaders. I'm one, I've been working on TJ Cox's